Excellent. Hello, everyone, and welcome to our talk on Where Next, Spotlight on the UK's role in global health. My name is Chaitra, and I am the National Director of Students for Global Health. So we're doing this webinar in collaboration with Students for Global Health and Action for Global Health. And I'd just like to introduce a few people. So we have Katie, if you want to wave and say hello. So Katie is also from Action for Global Health, and we have Kerry, also from Action for Global Health, here with us. And from Students for Global Health side, there's Rhiannon, our Policy and Advocacy Director, Tafad as well, our Coordinator, and we're all here to give you a little bit of a spotlight on what is the UK's role in global health. We also have our parliamentary guest, Lord Nigel Crisp. If you want to just say hello quickly. Thank you very much. So without further ado, we'll just go on to talk to you about the agenda for today. So we've done our welcome, and we're going to have a bit more of a some intro. So I've given some time so that we can have Lord Crisp speak for longer. So then, and then we will have some comments from Lord Crisp, some briefing on the UK's role in global health, and a quick fire quiz, telling you guys a little bit about Healthy Futures campaign and what we can do in the future. And finally, some time for Q&A and a close. Before we go forward, I just wanted to ask, so we are going to put a Google document in the chat box, which you can use to write down any questions that you have for the within this webinar. So whenever you have questions, please put them in that Google document. So that link will be posted soon. And at the end of the webinar, we're going to ask you guys to please fill in a evaluation form so that we can see how we can improve what we've done today for the future. So I know that some of you may not have heard of our organizations before. So Students for Global Health is a national registered charity that has 36 branches in different universities across England and, well, across UK. And we work on tackling global health inequalities and educating students on regarding that. And I'll let Katie do a quick introduction of Action for Global Health as well.
Thanks, Chaitra. Hi, everyone. Thanks so much for joining this webinar. As Chaitra said, I'm the coordinator at Action for Global Health, and joined this evening by Kerry, my colleague who leads on our communications and campaigns. Action for Global Health is a network of more than 50 organisations based in the UK, working across the full spectrum of global health issues, from health system strengthening and universal health coverage to particular disease areas like malaria, and HIV/AIDS and others as well. We play a role convening civil society to meet with UK government on global health issues, and really excited that we recently launched a report called the Stocktake Review, which analysed what the UK government are doing on global health and how they're doing. I'm looking forward to talking about that in a bit more detail later on this webinar. Thanks, Chaitra.
Brilliant, thanks so much, Katie. And so without further ado, I'm going to hand over to Lord Crisp, or Nigel as he likes to be called, to talk a little bit about his work and his experiences, and also what does the UK do on a parliamentary level in terms of global health. So over to you.
Great, well, thank you very much. And thanks to both organisations, Action for Global Health and Students for Global Health, for inviting me. And by the way, Katie, I thought the Stocktake review you just referred to was excellent, and I agree with the recommendations. So I hope you keep on pushing those. Let me just, in starting though, pay tribute to all of you who are working in the health system at the moment. This is a pretty tough time. I have lots of friends. I'm no longer working in the NHS, but I have lots of friends who are working in the NHS, and I know something of just how tough it is and how anxious making it is, and how worrying it is for you and for your families and so on. So let me just pay tribute to all of you and indeed the other health workers involved. I think that leaves me 4 minutes to give you an overview of context of global health. And I'm going to do it in three parts. Just the first one, just to make sure that we're clear, is that the World Health Organization, the global body, has got essentially three big priorities based on the patterns of disease, really, which are non-communicable diseases, universal health coverage, and of course, emergency and pandemic action on emergencies and pandemic. That's the big one at the moment. But actually, the other two will keep coming back to us, because actually in the longer term, we've not only got to win the war, if you like, at the moment on the pandemic, we've got to win the peace. And non-communicable diseases, the big priority and such a big impact, as you'll all know, but also universal health coverage. Still something approaching 1 billion people around the world who don't get access to healthcare. Let me bring that to the UK. Your stocktake report obviously describes a great deal of what the UK government is doing, but actually within the UK, there are 2 or 3 things that are really important. Firstly, the UK is one of the better countries for supporting multilateral action. Really important that they support and develop Gavi, for example, the Vaccines Alliance, the Global Fund, and indeed even in the last few months, the current government has increased its contribution to the World Health Organization. So we Brits believe in global solidarity, and it's really important, and that's been a big thrust of our work. The second area that's really important, and again you'll have some knowledge of this, is just how strong the UK is on research. From the All-Party Parliamentary Group on Global Health, we did a mapping of the UK's contribution to health globally. So not just what it's doing on global health, and you're going to have a definition of that later, but actually for health overall. And it's a great footprint that we have. You can see that on our website, and I'll give you the reference a bit later on. So, you know, those aspects of working with multilaterals, having a great research and development, and we're trying to press from Parliament, we're trying to press the government to make health and health science absolutely top of their priorities for the future, or right at the top, amongst the top 2 or 3 of their priorities for the future, because that's we have a great capability in that in our country, and we can do even more. Let me finish though by just picking out 3 things that I think are really important and which are slightly different, but they fit in that wider context. 3 things I've written about, but 3 things I think are really important. The first one is people, health workers, health staff. Biggest shortage in the world. I work quite a lot in Africa, and actually, of course, money is short, but actually people, and people with knowledge is in many ways the greatest shortage. And remember, health is a human contact sport. You know, it's about technology, of course, great technology, but actually it's about people. And we really need to get much more emphasis on human resources. The second area, which again has been influenced by my work in Africa, is around the whole issue of health, not healthcare, but health, and creating health. Not prevention, not preventing disease, but actually creating the conditions for people to be healthy. Again, I've learned a lot about that from Africa and Southeast Asia. And the third area is that moving forward, we need to get much better at what I've called for 10 years, actually, co-development, not international development, not top-down telling people what to do or whatever, but co-development, because we've all got something to learn and we've all got something to teach. Really important themes. So for me, these are 3 of the big themes that I hope you think a bit about, which is about human resources and how we move that field on. Secondly, about health and creating health. And thirdly, about co-development and partnerships. Now, I'll just ask for a slide to be put up, if I may, Kerry. I think you've got a slide with contacts on. If you're interested in any of the things I've talked about a bit more, my personal slide website there has got earlier books I've written, like Turning the World Upside Down, which is about what we can learn from poorer countries. The second one, Health is Made at Home, is the work I've been doing recently on creating health. And then the APPG on global health is where you can get the various reports from the APPG, which have been on a whole range of issues, but importantly, the one I just referred to on mapping. Right, I'm going to stop there, and then I know we've got a minute or 2 for questions. So thank you very much.
Brilliant, thank you so much, Lord Crisp. I think that we have a question from Rhiannon.
Yeah, Thank you so much for your presentation. I really enjoyed your point about co-development and also the book that you were talking about Global North learning from the Global South. And I was wondering what reflections you're having on that piece of thinking during the COVID pandemic, and what you think that countries like the US, UK and Europe more broadly can learn from Sub-Saharan Africa or Asia in particular as well.
Well, I think there's an awful lot that we can learn from Africa, and Africa and Southeast Asia are basically the parts of the world other than the UK that I know, although I've been at Harvard and done various stuff in America. But in those areas, I wrote this book, Turning the World Upside Down is what it's called. It's what we can learn. And one of the biggest themes in it is learning from how you engage the community and how you work with people in the community. And there's such wonderful examples, because people, without our resources, but also without our baggage of history and our vested interests, can sometimes innovate in different ways. Now, people have got much less resources, the services are poorer, but the people are great, of course. So this isn't, you know, saying how wonderful things are, but it is that people can innovate. And you see the engagement of, in Bangladesh, for example, BRAC, its top line strategy for health is empower women. You know? And you can understand why once you start to think about that in terms of everything from childbirth and childcare through and so on. So very different approaches. So much we can learn from that area. Interestingly, in the UK is now more fertile ground. You'll have spotted during COVID how much communities have come together. Not all of them, but some of them. And how, you know, in our local community, people look after the older people and set up gardening clubs and you know, food banks and all this kind of stuff, which is really vital. And that's all about creating health. It's all about creating the conditions for people to be healthy. US medical students are taught about the causes of ill health, quite rightly. But there's some stuff there as well about the causes of health, which we need to understand and get better at.
We have one more question. So this one is, how can we most effectively influence government prioritization of ODA and global health work, especially in light of the DFID-FCO merger?
Well, I don't know that the DFID-FCO merger makes that much difference, really, in the long term to where we're going. But I think you will influence it in the same way as you've done before, which is reports like the one that you've just produced, Katie and colleagues, which is important, influencing individual parliamentarians. But the biggest influence, you know, is getting people to actually see things. You're students, I've been a student. We learn by reading stuff, but actually most of us learn and get really engaged by doing things or by being there or whatever. And I knew a lot about Africa before I started working there 15 years ago, but I know so much more now, because actually I know what it's like in an African hospital. I know, you know, I know how, what it sounds like, what it smells like, and everything else that goes with it. And I've met the people. And one of the things that some groups do is they try and get parliamentarians to experience things. They try and get, you know, the one or two of the NGOs that take parliamentarians to Africa or whatever, or try and get funding, you know, or introduce them to people, because that is one of the ways that, you know, politicians are humans too. And they will learn they will learn from things they see and experience. And then, of course, the other thing you've got to do when you're dealing with politicians, and I'm a crossbencher, I'm independent, I'm this peculiar thing we have in the UK, an independent member of Parliament, as it were, of the House of Lords. But the other thing that you've got to do is take account of politics. And if you're trying to influence people, then you've got to know where they're coming from. And you've got to just try and think, what does it look like from them, from their perspective? How can I get this, even though I may not agree with them politically, whoever they are, how can I get this so that it looks like it might be appealing to somebody who thinks like that, if you see what I mean. So I think those are the three things: evidence and reports, personal experience, and don't underestimate that, and then working out where they're coming from. pretty quick summary, but I think those would be the sort of three first things I'd think about.
Brilliant. Thank you so much. I think that was an excellent summary and excellent answers to some very good questions. Thank you guys for the questions as well. And Lord Crisp, thank you so much for keeping to that time and giving us so much information. And we are glad to have you as a patron of our charity as well. And I hope all the best to you as well. And I hope everybody else enjoyed that little insight into what Parliament looks like for global health. Thank you very much.
Thank you very much. And enjoy the rest of the session. Thanks. Bye.
So with that further ado, we're just going to, you may have heard a few times that Lord Crisp mentioned something called a report that Katie has done, AFGH has done. So you may be wondering, what is this? Why are they talking about this report that we haven't seen? And lo and behold, we will be talking about that report throughout today. So first of all, we just wanted to do a quick delve into what global health is and also having a look at UK and global health. So some key definitions for people, for all of you to know. Global health is currently defined as an area for study, research, and practice that places a priority in improving health and achieving equity in health for all people worldwide. I want to say that there are many different definitions for global health, but that's the one we'll go for the time being. And health systems are organizations, people, primarily intended to promote, restore, and maintain health. So it really is anything and everything that goes into health systems. So the hospitals that you see, but also the primary healthcare system, the social care systems should all be included within that. Universal health coverage is a key topic for us today. So this is looking at making sure all people and communities have all the healthcare access they need, and they're of sufficient quality, but also they're not facing financial hardship. And you can imagine there are people around the world who might have all of these things in their country, but they have to pay so much money that they become bankrupt by the time that they access the services. And even if they are treated and get better, they have economic loss afterwards and suffer more issues. Official Development Assistance, or ODA, is government aid that promotes and specifically targets economic development and also welfare of developing countries. So we will be mentioning ODA a few times in this talk, so just so that you're aware what this means. And low and middle income countries, countries with a gross national income per capita that is below $1,036, well, between $1,036 and $4,045. So that is a few definitions. Now, this is just looking at global health issues, defining our times. So there's quite a few different things here. So in the past 2 decades, there has been momentous progress in improving health in low and middle income countries, actually. So there's lots of changes, lots of improvements, everything that, but we still have many challenges. And some of you may be aware of the Marmot Review 10 years on that was released, which sort of showed how inequalities are just rising between different classes. And this is one of those ways to show where challenges are still remaining across the world. More than half the world's population still lack access to essential health services and also pay out of pocket for their health services. And this puts people in poverty more and more. COVID has exacerbated all the existing inequalities, and I think this year people have become a lot more interested in global health after seeing how fragile health systems are, even with the ones that were, you know, poster childs or ones that were seen as the perfect ones. That includes us having huge struggles. And some other things that are also causing issues for us are this conglomeration or relationship between non-communicable diseases and communicable diseases, both causing mortality and morbidity all across the world. And in low and middle income countries, they're sort of stuck between, you know, a rock and a hard place, because they have both sort of hitting them on both sides. And right now for us, we're in that because we have COVID as an infectious disease doing that, as well as all the non-communicable diseases that we are faced with on a day-to-day basis. So the COVID-19 access to healthcare impacts has meant that 178,000 more children are projected to die of acute malnutrition in 2020 than expected before the pandemic. So things such as children and their malnutrition and stuff is also of a big concern for us at this point in time. So I'd like to just let Rhiannon now explain a little bit more about the actors that are involved in the global health sphere.
Great, thank you, Chaitra. Do you want to go to the next slide, Kerry? Okay, great. So I thought I would outline in brief kind of the main channels through which the UK, not just the UK government, but actors in the UK influence global health, because that also helps us to think about how we can positively influence these channels as well. So these are some of the main channels through which UK institutions influence global health outcomes. And yeah, I really wanted to highlight that it's more about the projects. It's more than just the projects they fund, because the UK has significant power in health, and many of the determinants of health are influenced by non-health political decisions as well. So it's really important to think about the whole spectrum. So if we start with academia, as Lord Crisp mentioned, the UK is a centre of excellence for a variety of academic disciplines, lots of which influence global health. And people come to the UK from across the world to study global health, for example, teaching at places like the London and Liverpool schools of tropical medicine reaches globally. So the influence of UK academia is very strong in global health. As also mentioned by Lord Crisp, funding multilaterals, and this includes UN bodies and international health organisations such as Gavi and the Global Fund, is really important. The UK is the largest funder of Gavi and the third largest public donor to the Global Fund. So the funding is really important, but also by being a large donor, the UK can influence the structure and policies of these organisations as well. So that's another really key point to think about. The NHS is a really useful tool for influencing global health in a number of ways. It allows the UK to potentially, and has often been, a leading voice in universal health coverage, but the NHS also attracts health professionals from across the world. So the NHS and its history and the narrative around that is a really important influencing point for the UK's role in global health. Another one is research and development. So medical research is actually still a top cause to which the UK public donate. And the UK has a really vibrant and highly productive life sciences sector, and research institutions in the UK contribute to global health, the global health agenda, and also the development of health technologies. And then a key step is then making sure that research and development that's done in the UK can benefit as many people as possible across the world. I've put trade on here because trade is an often overlooked area of global health influence. People tend to think that it only influences economics. In fact, trade and health are highly interlinked, and the overlooking of this issue is sometimes what allows certain trade policies to have a negative impact on health. So the UK's health influence via trade can come in bilateral trade deals or decisions at the World Trade Organization, and in particular, some areas where this is highly influential for health include food, agriculture, pharmaceuticals, finance, and the energy sector. Moving on to NGOs and civil society that are based in the UK, they play a significant role in advocacy, so holding governments to account and campaigning for important causes across the world, but also in programming. A lot of programmatic operations in other countries are run by actors in the UK, which of course influences global health in the way that they choose to do their programming. The bottom left-hand corner, you can see that climate change is on here, because the decisions that the UK makes, along with many other high-income countries, on domestic and foreign policy related to climate change and energy will influence the health of billions of people for years to come. So as one of the largest historical emitters and the COP26 president, the UK has the opportunity to kind of lead on this area and put words to action for health as well as for climate change. International advocacy is another really important area where the UK has a lot of soft power, because it can be quite a strong advocate for the right to health for all people globally. We have a decent track record of supporting access to health, gender equality, civil society, and the rights of minority groups worldwide. So that soft power and the advocacy on the international stage is really important. And finally, which leads us nicely into the next part of this webinar, one of the huge ways that the UK influences global health is through its role as a major donor through overseas development assistance to programming in other countries. And it's incredibly important, as Katie will go through, that this funding is used in a way that is most beneficial to the countries it's serving, spent in an evidence-based way, and promotes health equity. So we're going to go into more detail about this now. So I'm going to hand over to Katie.
Thanks, Rhiannon. Perfectly introduced in terms of the reports. Yeah, so we decided about a year ago that we wanted to do a report that would analyse how the UK government's performing on global health. And we decided to split that up by kind of looking at how they're doing politically, financially, and programmatically. The reason we decided to do that, exactly as Rhiannon said, the UK is the second largest government donor to global health. So they're a hugely important and critical player in terms of progress on global health and how that's achieved. Obviously, COVID and the impacts that Chaitra was describing means that the UK's role is even more important than ever, because we're seeing these impacts of COVID on lots of different health areas. So as a kind of significant donor, we're really keen to see the UK being the absolute best that they can in terms of how they use their funding and leverage and programs to make progress on global health. It's a bit of a mixed picture right now in terms of how the UK government are doing. Obviously, from a financial perspective, they are the second largest government donor. So they're giving, substantial amounts of funding, and we'll go into a bit more detail about that. But at the same time, as you'll see on this slide, during recent cuts to the aid budget, and also with the merger of the FCO and the Department for International Development and the Foreign and Commonwealth Office, as was raised in the Q&A with Lord Crisp, we failed to really see this government making global health a priority. And so we have some concerns, particularly around the lack of a global health strategy and commitments to crucial areas like universal health coverage and core health systems. So we conducted analysis looking across the full portfolio. The UK government, as I said, a huge donor to global health, and also have over 200 active programs in low and middle income countries around the world on health. So we did an analysis of all of that to see how they're performing. And I'm just going to run you briefly through some of those headline findings now. Thanks, Carrie. So firstly, how are they doing politically? We decided to kind of approach this with a bit of a traffic light system, as you'll see on the screen, to assess how the UK are doing. In terms of health and how it's being prioritised within the broader UK government approach to international development, again, it's a mixed picture. So we're seeing the UK have been a really strong champion on certain health issues, sexual and reproductive health and rights. We see UK being really outspoken and championing this issue politically. In terms of communicable diseases, we've also seen that in terms of malaria and HIV/AIDS. But as I mentioned, with the merger of the FCO and DFID, we failed to see global health kind of being centred as a priority for what the UK government focuses on in terms of international development moving forward. This government committed in their manifesto to a development commitment to end the preventable death of newborns and children by 2030. That manifesto commitment seems to have slipped a little bit off the agenda. So when we've seen the Foreign Secretary sort of announcing priorities for the new Foreign Commonwealth and Development Office, that manifesto commitment was missing from that list of priorities. So we have some concerns about sort of political championing of global health. This is linked to sort of an underlying issue from our findings, which is the UK don't have a global health strategy or any document or position paper outlining their approach to global health. The last global health strategy expired in 2013, so a long time ago now, and we haven't seen any position papers sort of outlined since then. A global health strategy is crucial for a whole number of different reasons: transparency, accountability, and also just giving us a sense of what the UK government's priorities actually are on global health and what they're to achieve through the funding and the programmes that they provide. So this is a real kind of red flag for us. Fortunately, and as we heard a little bit from Lord Crisp earlier, support from the UK Parliament for global health remains really strong. So we have a number of all-party parliamentary groups like the Global Health one that Lord Crisp leads, but also APPGs on malaria, HIV/AIDS, sexual and reproductive health and rights, vaccinations, and a whole active set of parliamentarians who are really the UK to prioritise global health. So that's been really positive. Next slide, please, Kerry. In terms of the funding picture, as I said, the UK government are the second largest donor. In 2018, that was equivalent to 2.16 billion in terms of official development assistance. So they are contributing a huge amount. The reason that we've highlighted this as being an orange area is that the impact of COVID means that budgets have essentially been reduced in terms of aid. And it's still yet to be seen whether or not that the global health budget has been impacted by those cuts that we've seen. And hopefully that will become clearer over the coming months. Multilateral funding, you've heard lots about that on this call already today from Lord Crisp and Rhiannon. The UK government are doing really well in terms of multilaterals. They're a big supporter of organisations like the World Health Organization, Gavi, the Vaccine Alliance and Global Fund, which others have mentioned, which have really been able to kind of scale up interventions, vaccine interventions, communicable disease interventions at huge scale around the world with really massive impact for people's lives and people's health. Bilateral funding, again, it's a slightly mixed picture. So 1 in every £4 of bilateral ODA is now going to medical research. So we're seeing the UK being a really strong funder in terms of research. We're also seeing ever increasing funds going to sexual and reproductive health and rights, which is really positive and really welcome given the kind of rollback on that area that we've seen in the United States and from some other donors as well. However, we're seeing ever decreasing amounts of bilateral health official development assistance going towards sort of basic healthcare and strengthening health systems. And obviously we've seen from COVID that can have huge impacts in terms of the ability to respond to both COVID and to maintain all of your other essential health services and keep those going. We'd also like to see, you'll see in red on the right hand side, we'd like to see much more funding going directly to actors and organisations based in low and middle income countries. The report's findings on this were quite stark. So in terms of aid funding going to NGOs, we found that over 93% of the funding was going to NGOs who are based in the UK. In terms of funding going to private sector organisations delivering health programmes, 96% of the funding was going to private sector organisations based in the UK. This has huge implications in terms of ownership, building up strong kind of public health systems and kind of sustainability in the longer term, but also crucially for reaching particularly vulnerable and marginalised communities. We know that kind of local community-led efforts will be much better in terms of reaching those who are left furthest behind. And in terms of systems and again, kind of longer term sustainability, we'd also like to see much more funding being channeled to recipient governments as well. So we found this had really decreased over recent years in terms of funding going to governments, and this is crucial in terms of helping them to build their systems. Cross-government funding, the merger of DFID and FCO leaves things a little bit unclear, I guess, in terms of health funding, both in terms of the budget cuts that I've mentioned, but also the Foreign and Commonwealth Office. There was criticism previously around the transparency with which they were delivering their health programmes. So we'd like to see through this merger a kind of increased transparency and accountability about the delivery of programmes as well. Thanks, Kerry. Next slide. So closely connected to the financial piece, we'd like to see the UK doing much more in terms of strengthening health systems. So the UK have a very strong history on things like maternal and child health services, sexual and reproductive health, tackling communicable diseases, but we'd like to see more of a horizontal approach to the UK's programming. So rather than setting up different funding and different programs for different diseases, we'd like to see them sort of building up the health system as a whole and kind of strengthening the health system across the board through their investments. As a critical part of that, obviously the health workforce. So in order to have a strong health system, you have to have a strong health workforce to deliver your essential health services, as you'll all know better than myself. And connected to that, strategies advancing universal health coverage. And what we really mean by this is that universal health coverage is not just about getting the health services that you need, it's about getting them in a way that doesn't put you into any financial hardship. So we'd like to see the UK doing more to make people protected financially when they go to access health services. So we don't want to see people being put into poverty or put out of pocket or put into or having to spend catastrophically in order to get the essential health services that we need. And we felt that we could have seen more of that coming through in the UK's health programmes from our analysis. So that was a bit of a kind of swift overview of our findings. What would we like to see the UK government doing as a result of that? Up on the screen, you'll see 7 key recommendations that we've made to the UK government for what we'd like to see them doing. We'd love to see them publishing a global health strategy. We think this is really important to outline their approach to global health so that we have a real sense of their priorities and how they see themselves reaching the target of achieving universal health coverage by 2030, or how their programs are contributing towards that target. We'd like to see global health being prioritised. So you've heard that the Foreign Commonwealth and Development Office and the Foreign Secretary is yet to really place global health as a central priority for this new department, and that's absolutely critical. And we want that to be global health in the broad sense, rather than just a narrow focus on the COVID response or on pandemic preparedness. It needs to tackle global health in a broader sense. We'd like to see them continuing to be a substantial government donor. The World Health Organization recommends that donor countries maintain their official development assistance above 0.1% of their GNI. UK government is still meeting that just above, so we'd like to see them continuing to commit that funding despite the reduced fiscal space that we're seeing as a result of COVID. And in terms of how that funding is spent, we'd like to see that being shifted more towards Southern actors rather than to organisations that are based in the UK. It just doesn't feel right that more than 90% of funding, both in terms of NGO funding and private sector funding, is going to organisations based in the UK rather than in the countries where the programmes are based. We'd like to see a bit of a technical one here. We'd like to see them optimising national health budgets. Essentially, we want to see the UK giving technical assistance to countries to help them build up their own financial management systems. We want to see them increasing domestic resources for health. So we know that official development assistance or aid on its own is never going to be enough to meet the targets that we want to reach and to create healthier lives for everyone. It needs to be a mixture of domestic resources for health that is then supported by aid as well. So we'd like to see the UK doing more in terms of technical assistance. And we'd like to we'd like the UK government to ensure that all of their programming is contributing to strong, resilient health systems. Finally, we think there's an opportunity. The UK is hosting the G7 from December for a year. This is a moment to put issues high up on the political agenda. So we'd like to see the UK government promoting a vision that goes beyond COVID, a vision for global health more broadly. I think Lord Crisp spoke about not just sort of dealing with the immediate emergency, but thinking about how can we create a healthier world in the long time. And we feel like there's never been a better opportunity for that than there is right now, with how COVID's highlighting how important health is to all of our lives. So that's an overview of the findings of the report. I think there's going to be an opportunity for Q&A later, but I'm going to pass back to Chaitra now, and I think it's time for the quiz.
Okay, as all sessions where we share lots of information, we're going to do a little poll. I hope that made sense. And if you guys have any questions about what was mentioned here, if you want to clarify something about the report, please write them in the Word document. We'll try and answer as many of them as possible. And if we don't get to, we will just answer them separately and then email it out. And share it on our channels as well. So please do put some questions down. So I'm going to launch a quiz, a poll. So hopefully you guys will be able to see it on your screens. And if you can answer these 3 questions, if you were listening and reading, you would have got all the answers. So let's see if we can do that. So you have a minute to answer. A minute and a half, because there's 3 questions, let's say. So if people could have a go at answering. Only I can see what's happening with the results. So 17 people have answered so far, 18. It's going well. Okay, 10 more seconds for anyone who hasn't answered. And time's up. Thank you very much. So let's have I'm just going to show everybody what everyone put down. So the first question was, how many people die each year in low and middle income countries due to poor quality healthcare? And we had most answers being 5 million. The next question was, which health programmatic areas are underfunded by UK support? Health systems, health workers, universal health coverage, or all of the above? Maybe a slightly easy question there. And the last question that we asked was, which of these is one way that, the UK could strengthen its contributions to global health? And everybody who answered has put down putting global health at the center of the Foreign, Commonwealth and Development Office's work. So I'm guessing that's going to be right. So I think now Kerry can show us what the correct answers are. It should be on the screen now. So I think, thank you for listening, everybody. First of all, on this Thursday evening, and yes, I hope that it's not 12 million with the how many people die. It's 5 million, but it's still, that's a lot. And all of the above, yeah, we do need to put that. And definitely, if you put global health at the center of FCDO, you are then looking at B and C already. So that is our thoughts there. Okay, I think we're moving on to passing on to Kerry for what can you do?
Hi everyone, thank you so much for joining and great participation in that quiz. Yeah, I think that's the most answers I've seen get correct on interactive quizzes, so fantastic. So now over to you really. So what can you do with all this information and how can you play a part? And as members of the public and the UK, we can definitely play a part in influencing the UK to do better. It can do more and it must do more. And as you've seen from some of those shocking findings in the Stocktake report that Katie presented, there are many gaps that need to be addressed. And while COVID and other issues are draining resources, we're still one of the highest donors, and we have potential to lead others and be a positive inspiration when it comes to universal health coverage, health system strengthening, and health worker capacity. So how can you get involved? So we launched a campaign just this week called Healthy Futures. I'll just read the campaign copy for you. So we're at the tipping point for creating a healthier world for all, but we need countries working shoulder to shoulder. And that's not just the UK, but all countries working together to really make this a reality and see mass change. And now is our time, really. Like, the tipping point is COVID-19. I think there's no clear example that health systems are simply not cut to take on public health threats like this. We don't have the capacity or resources or the number of health workers needed for the 21st century and some of the issues we're facing, nor going into this quite scary climate crisis. Equally, we're not equipped for that. So now is really the time, and Healthy Futures for everyone starts here. So we can build health systems that work for everyone and that are reachable, accessible and affordable for all. And what can you do to make sure we get there? So you can visit healthyfutures.uk. That's the exact address. If you just type that into your search bar later or tomorrow, whenever you have time, sign up and add your voice to our Healthy Futures Changemakers list. And then in just 2 weeks or so, you'll receive an action pack in your mailbox ahead of Universal Health Coverage Day, which is on the 12th of December. And you can join and be part of our movement driving progress to health for all faster. So that action pack will include key ways to get involved and put pressure on the government to pay attention to Universal Health Coverage Day. Historically, it hasn't had a huge amount of noise and media coverage around it, but this year really is our moment. Like, we've had COVID, there's no clear example of why they need to invest in global health. So please join our movement and take those actions. So it's healthyfutures.uk. Sign up just with your email address and you will receive that action pack.
Brilliant. Thank you so much, Kerry. So before we go on to questions, we have a video from Preet Gill, MP. So if you guys could take a minute to click on that link and watch the video, we would be that would be amazing. So if you guys could take, I think the video itself is approximately 2 minutes long. So I'm going to give everyone till 7:23 to have a go at looking at that video, and then please come back so that we can answer all those questions that you have. Brilliant. I hope you guys have just about finished watching the video. If you haven't, please, you are able to see it at a later time. So that was Preet MP just providing a few words about why we need to focus on global health as an issue nationally. So we will be going to questions now. I'm also going to put a link to an evaluation form in the chat box. So if people who are not asking questions, well, during the Q&A, please fill it in, and maybe afterwards as well, just so that we can make sure that we can improve such events in the future, because we are going to have a series of webinars focused on UK's role in global health in the future as well. And it will be not just Students for Global Health, but other organisations providing that. So without further ado, I think, Taf, you have the questions. Would you like me to ask them, or are you happy to do the...
Yeah, I can ask the questions. I will start with the first one. How are SFGH and AFGH and other global initiatives ensuring that we are decolonizing global health rather than perpetuating harmful stereotypes on a one-way flow of knowledge?
Yeah, I think that's an excellent question. And as Policy and Advocacy Director, I can definitely give that a go. I think there are kind of three different ways in which we can think about this, in which we can act on this issue, which I agree it's incredibly important. And there have been some really problematic narratives and practices in global health for a number of years, especially based on the way that global health was founded as, kind of international health, protecting overseas colonists. So it's really important that we kind of dismantle these narratives and turn global health into something that is kind of promoting equity worldwide. So I think the first thing is to think about where knowledge comes from. And I think global health needs to move away from thinking like, oh, other countries need help, and isn't it nice that countries like the UK, who know so much, can help them. We really need to actively dismantle the narrative that knowledge and expertise come from primarily global north, majority white countries. And I think COVID-19 has shown that the UK itself isn't actually that good at its own global health. And things like the Global Health Security Index, which rate countries based on their global health security, rated the UK and the US incredibly highly and rated lots of lower middle income countries incredibly poorly. So I think we need to think very proactively and about the ways in which we think that knowledge is generated, and about what a good health system looks like, what knowing how to tackle a pandemic looks like. And I think challenging the narrative that knowledge comes from particular countries is a really important part of this. And then I think at the same time, you have to then also analyze what you do with money and power, and how you use those resources in a way that doesn't, that is, promoting decolonization, because the UK is a high income country and it does have a huge amount of influence on a global scale. And what we want is for them to use that to the best of their ability. And a big part of this narrative is recognizing where a lot of power and resources lie, even if that's actually historically probably not for the right reasons. And without saying this because one country knows more than the other, but then using that knowledge to hold that country to account. So the UK can spend its ODA better. It can improve its foreign policy to improve health worldwide. And the UK also kind of has a duty to do this. As a historical emitter, we have a duty to lead on decarbonisation. As a colonizer, the country has a duty to reinvest in lots of other countries. And the key question, I think, is how you get countries who do have money and power to assist other countries without perpetuating harmful stereotypes. And then I think the public communications is the third area, which I would flag as really, really important. So, no dehumanization, no presenting people as passive recipients of any of these issues. And I think one of the biggest things that we can do is you don't run a campaign about people, you run it with people. And I think that is actually something that we actually can improve on, is like when we do campaigns and advocacy, is making sure that we don't run it without representatives from whatever issue that we're campaigning on, and doing it in partnership. So I think that's actually an area where we could do more, definitely. Yeah, I hope that answers the question. And yeah, happy for AFGH to give it a go as well.
Thanks, Rhiannon. Yeah, I'd agree. I think it's such an important question. And certainly we recognise that we haven't done enough. We're currently going through a process as a staff team of thinking about how does decolonising global health, what does that look like across all of our areas of work? And also engaging with our members, recognising the fact that we're a network organisation. So we're hosting member meetings on decolonising global health as well. In terms just a few examples of areas of our work where we're already kind of taking action. From an advocacy perspective, I think we're pushing really strongly on the point that we raised in the report findings today around the point you're mentioning, Rhiannon, about kind of power and how that links to funding. So the shocking findings in the report that there's so little aid is going directly to organisations based in low middle income countries. We're pushing hard from an advocacy perspective on the UK government to really shift where funding is going and it's being used. And I think that also connects to global health governance and the institutions that are involved. There's certainly reform needed in terms of the involvement of communities, civil society representatives. We're seeing progress in some areas, but also not enough progress in others. In terms of public communications, I couldn't agree more with what Rhiannon just said. We started the process for this Healthy Futures campaign about a year ago, and as part of that, we decided that we needed to develop our messaging around global health in consultation with and in collaboration with health advocates based in countries all across the globe. So maybe, Kerry, if I could just pass over to you to say a little bit about that process.
Thanks, Katie. So we, in the UK, first of all, came up with draft messaging pillars of what we thought would be effective pillars or key terms for talking to the public about global health, and then took those to many of our colleagues and other grassroots organisations much further beyond Action for Global Health in the Global South. I think we had 5 regions at least contributing to that survey, and took on board all that feedback before we came up with the core messaging. So it was very much a co-creation of those messaging pillars, and a lot of the messaging you'll see, if for those of you who visited healthyfutures.uk, has been co-created with global partners rather than just being a UK project. I think that's a really important process to go through for any NGO based in the global north and south to be consulting other regions, especially if we're framing this as global health, then we need to be in consultation with each other when it comes to our language.
Okay, and maybe just finally, I just wanted to give a positive example about flow of knowledge. Some of you may have heard of the Tropical Health and Education Trust. They receive funding from the UK government for health partnerships, which is exactly about kind of the issue of one-way flows of knowledge, and is about building up partnerships between NHS institutions and health institutions abroad to facilitate that kind of flow of knowledge in both directions. And I think Lord Crisp referenced that a bit earlier in his remarks as well. They're an organisation he works very closely with, and I'm sure it was involved in the creation of the book that he was talking about. So there are positive examples certainly within our members of knowledge flows going in both directions, and that's so important.
Thank you. We have time for one more.
I think we have time for one more.
In response to the COVID-19 pandemic, do you think that the current International Global Health Network and its multilateral organizations like the WHO needs to be improved or adapted in any way?
Yeah, I'm happy to come in on this one. Again, I think it's brilliant. In terms of the World Health Organization, absolutely always great to be thinking about areas of reform and improvement, and a review of how they responded to the COVID pandemic, which is on the cards. We think they could be doing more and better in terms of engagement with civil society organizations and how they engage with us. on the flip side, the World Health Organization plays an absolutely critical role, and there is no other equivalent health organization that is able to respond in the same way. And I think it's been disappointing to see the United States withdrawing their support from the World Health Organization, and that's clearly going to have a knock-on impact in terms of their ability to function. More broadly, we've seen really great innovation in terms of multilaterals coming together to respond to COVID. Some of you might have heard of the ACT Accelerator, which has various pillars sort of responding to COVID, co-creating vaccines, therapeutics, diagnostics, and that's a number of multilaterals that you've heard about today, including Gavi and the Global Fund, UNITAID and others coming together and adapting their mandate to respond to COVID. So I think COVID is also encouraging sort of innovation in terms of how the multilateral organisations are set up, and it would be great to see that innovation and collaboration also continuing beyond COVID as well. Thank you.
Yeah, I think I would add to that by saying that actually one of the problems with the WHO is that it doesn't have enough funding or teeth. So like there are very few parts of the WHO. I think there's 2 parts of the WHO, maybe 3, that are binding for member states. The majority of everything that it does is voluntary. And so I think that's a really key point, is that actually, like, if the WHO had its way on most things would have been a lot better. But countries do tend to be like, oh yeah, no, we agree. And then like there's not actually an obligation to implement things. So I think that's one point. And I think another point, which I think kind of builds on the earlier question, is I think a lot of the failure to deal well with the pandemic has been partly a result of the idea that like high-income countries have got it sorted. Like, we know health, we've got it, we've done it. No, like we don't need to worry, pandemic, we're prepared, whatever. So I think like part of the global governance structures and these multilateral health organizations, part of what they need to do is kind of also think about refocusing their targets, because the international health regulations, I don't know if I gave this example earlier, but they are when they first came about, they actually did have a huge focus on preventing disease transmission from the global south to the global north. That was a lot of what they kind of were aiming to do. So there was a really large reporting burden on low middle income countries, and high income countries were kind of assumed to have it sorted. So I think rethinking who we're focusing and who we're targeting at, and looking at a much more global scale will help. And then I think thirdly is looking at the non-health influences of health. And I think so like the WHO is quite good at looking at things like social determinants, economic determinants of health. But other multilateral organizations and other types of global governance, like the World Trade Organization or bilateral trade deals, so other areas of global governance that are not the WHO, I think they can do better at making sure that those institutions are not undermining health and, are not, putting at risk non-communicable disease patients, for example, who will then suffer worse in a pandemic. So I think it's not just about strengthening, reforming global governance in health, but also looking about how like the whole system of global governance needs to be improved to make sure that we're not undermining health as well. That was a really good question. Thank you.
Brilliant. Do we want to spend another minute or so looking at another question? Happy to stay on the call, and yeah, let's have one of the questions solved then, Tam.
Okay. So again, yeah, for both AFGH and SFGH, what is the UK government doing in terms of encouraging gender equality in leadership positions in global health?
It's a really good question. And one that we didn't flag up really in the findings of our report. So I'm going to take a stab that they're potentially not doing enough if we haven't heard much about it. The UK government, as I said, is really strong on sexual and reproductive health and rights. They do have a gender equality strategy, and the gender equality strategy does link to health. So they certainly have some political papers and position papers in place that sort of support those efforts. In terms of how that relates directly to gender leadership in global health institutions, I don't really feel qualified to answer. but an assumption that we're not hearing much about it. So they could probably be doing more.
Yeah, and I would just say that we should maybe post that to Preet Gill and also to Lord Crisp, and maybe try and get some answers to you that are coming from parliamentarians. But yeah, we've also not seen, but maybe whoever asked that question has got some insights that if they're still here, would like to share. And if you do, just do write that in the chat of what you have heard, because that would be very interesting to know about. Seeing as we didn't have much of an answer to that question, I think we can also maybe have a stab at the last one. So the last question on here is, how do you think Brexit has affected UK's ability to collaborate in terms of research with other European countries, but also recruitment of healthcare professionals outside of the UK?
Another really interesting question that I'm not sure I'm fully going to be able to answer. I think in terms of the first part of the question around the impact of Brexit on collaboration and research, I think it's potentially too early to say at this point in terms of what the full impact looks like. Clearly, as the kind of findings from the Stocktake review showed, the UK has a huge role in terms of research. 1 in every £4 of health aid is going towards research, so it is a really critical, important area. I think the impact of Brexit on that is, I think we're just too early on at this point to see how much that's been impacted. On recruitment of health workers healthcare professionals outside the UK, I'd really recommend a report that was published by the Tropical Health and Education Trust, which examined sort of recruitment around the NHS in the context of global health, and whether at all sort of the approach of the UK to global health and building up the health workforce in low middle income countries was at odds at all or in conflict with the recruitment they were doing of healthcare professionals to the NHS. So I'd really recommend that report for whoever asked the question to go into more detail on that.
Yeah, I would only add, I think I would agree with Katie that obviously we don't know yet, but there's some somewhat concerning statistics already out. So for example, a lot of nurses in the NHS come from other European countries, and the application rates to be a nurse in the UK from EU countries have dropped 95% since the announcement of Brexit. So that's quite a lot of nurses, and I think it's a good reflection point to start thinking about health systems in the UK, and if we've got it right, because whilst the NHS is fantastic and is a world leader in so many ways, I think as we go through the Brexit transition and so much changes about our trade law, our regulations and everything else, it would be a really important time to reflect on what impacts how a health system is built and how it is run. And how you can make sure that that's done in the most equitable and the most sensible way possible, because I think there will be a lot of changes to the UK health system as a result.
Brilliant. Thank you, guys. That was excellent. Thank you for all the answers as well. So we have come to a close of our session. Thanks everyone who participated, and for everybody who also filled in the evaluation form. That was really very, very useful for us. I hope you enjoyed that and you had a good time. So I hope that you can all visit healthyfutures.uk and also join up. And also visit our SFGH handles on Twitter, Instagram, Facebook, and AFGH on Twitter and Facebook as well, for any updates on what we will be up to throughout the year. And look forward to seeing you guys again. So thank you very much.